something that I wanted to follow up on, and that was I wanted to get a sense from you, your perspective on treating men. Urology treats both men and women, but certainly the majority of the patients are men. And so I'd really like to hear from you those pearls on your approach to that. And then secondly, your observations in terms of outcomes of men and disease processes.
So we're very fortunate to be at Loma Linda, and I take the healing ministry of Jesus Christ very seriously as our charge. And working in urology, though you do work with men and women, you get a lot of exposure to men. Like you said, the majority, about 70% of an average urology practice would be men. And interestingly, one of the health disparities that doesn't get very much play is the fact that men have about 4 years less life expectancy than women do. So that's a big deal. And even as important of that is about, I think it's 6 or 7 years less what we would call health expectancy. That would be the time when you're mobile and you're doing what you want to do in good health. So when you look at all of the causes of mortality, men are top in every one of those except Alzheimer's disease. And that's because women live longer, so they get more exposure to it. So dealing with men, you have to realize that when you're in urology, you're dealing with the whole package. So Anthony and I have talked about this a lot, and so you've got the basic things of cardiovascular health, number one killer in men. Other cancer screenings besides prostate cancer, bladder cancer, kidney cancer, you've got colon cancer, lung cancer. Those are really important to make sure that men get their screenings. Orthopedic surgery. Being mobile helps you live longer. So if you talk about the pandemic and hip replacement is an elective surgery, if an older man is not able to move, his life will probably be shortened. So elective is relative. So there's movement, and then there's brain. Brain health is multifactorial, but it involves engagement, family, interest, nutrition, and all those things tie together into men's health. Now, it's easy to centralize it in urology because we have one of we deal with voiding dysfunction, we deal with erectile dysfunction, sexual function. So those are things that where men tend to deny and delay. Those are many times the things that they will seek care for. And then it's what I try to do, is try to bring these other things into it. Because ultimately, if you think of the individual complaint or problem as the battle, it's important to win the battle, but what you're really trying to do is win the health war, trying to tie it all together. And some of my most gratifying times are when I do a specific cancer surgery, but the man comes back and says, I really took to heart what you said about the investment in this and how I need to think holistically about my health because I've made this big investment to cure one thing, and now I need to change my life and my lifestyle to try to get more out of it.
That must be so gratifying. What do you say to them to kind of win the war, as it were? What could we be saying to the men we care about in our lives?
Well, you have, myself, I individualize the message. So I'm like an interviewer like you, but I'm looking for that, I'm looking for what resonates with them, what's important, what matters. And then I will be very straightforward with them, such that, I will challenge them to, decrease their belly fat. I mean, I will be very straightforward with what I think their deficiencies are, and many times that comes, it comes back to habits, if you will.
Yep.
We could say lifestyle, we could say habits, But when they're sitting and watching TV and having a chicken wing versus having a carrot stick before they go for a walk with their wife, those are habits that impact their long-term health.
It's interesting. I feel like you almost have to educate, like what you just said, that these are all connected. That these systems, this one issue that you're having is connected to your overall health.
Well, we talk about wholeness, and yes, the whole person is all connected.
So I'm going to ask you to do the impossible, just because it's kind of fun. So you have right now in front of you hundreds, if not thousands of men. If you were going to give them one or two takeaways for their health to say, hey, I want those 4 years, or I want that additional decade that my wife's going to have. What are things I can do to start that today?
Well, one of the things is probably listen to your wife.
Oh, amen. Did we get that on film?
I think we're going to delete that one spot.
Wait, can that be our teaser?
But listen to the women in your life, because they generally are more into proactive dealing with health. So, like I said, you need to have good habits. You need to tweak your diet. Diet is something that starts in preferences when you're young. You're a little kid and you build these things through your life. So it's not easy to change. But you need to turn the dials, because you need to have less animal fat, less animal fat. You need to have a little more activity. You need to have foods that have a high glycemic index. Diabetes type 2. I saw the screening age just went down to 35. It's an epidemic in America, and that's a life shortener. So what I would say is that it is, you need to listen to the women in your life, because they will probably encourage you to be screened for the important health problems that would shorten your life, which would be cardiovascular disease, diabetes type 2, basic cancer screening. In urology, it's don't ignore blood in your urine and know what your PSA number is. PSA is a blood test that helps identify prostate cancer, and that could be something that would be important, but you need to know. You don't know unless you ask the question. And then move and engage. What I mean by that is movement is good. Anything. The advice that I give is you can probably help things the most by after your evening meal going for a walk with your wife. That will help you engage, talk, communicate, takes away distractions, and you're moving. And it's very simple. The thing is, it's simple and cheap.
So that means that I need to go with Tammy and take Mario and Cinnamon to Caroline Park in the evening.
So I actually see Tammy walking with Mario alone. So yes, I would advise that.
Well, called out on that one. And that is something, though, you do live. I've seen you walking in Redlands. I've seen you out and about. And I feel like that really must be incredible that you can really send that message to your patients, but also you live it yourself in what you do.
It's a simple formula, and life is not perfect, and health is not perfect. But I view it as sort of changing the probability so that it favors you.